From India, we shift to the West Indies, not to play cricket, but to listen to Dr. Godfred, who's recently shifted from Middle East to West Indies to St. Vincent in the Caribbean, who would talk about point of care testing, because this way you would quickly know and you will be forewarned before the paradox that the fever subsides and you enter the critical phase. And that's why you need tests which will inform you in time so that appropriate action can be taken. Dr. Godfred, please.
Many thanks, sir, for that warm introduction, and good evening and good morning to the lovely audience. So the earlier presentations have extensively covered features of the virus and pathogenesis, complications, and diagnostics, mostly all the aspects. My job is a tiny bit to be covered. So that is about point of care testing for dengue, bridging the diagnostic gap in resource limited settings. So the objective mainly is to cover evidence, challenges, and life-saving potential of POC-T. So in short, the objective is to clarify if POC-T can save lives, as Sir said. Yeah, so there is quite a lot of skepticism regarding perceptions of POC-T, and in my presentations, I'm supposed to look into the reality of the POC-T, and POC-Ts are unreliable for dengue diagnostics according to the perceptions of certain academics and government authorities, and the root causes for these perceptions include variable sensitivity and specificity, lack of standardization, and limited real-world validation. So, which could not happen pre-2012. In 2012, we did have a landmark validation. Yeah, so naturally, the rapid diagnostic test could help in preventing severity of the infections and definitely save lives. Next slide, please. Next slide. Yeah, so this particular paper in 2012 from Singapore was a landmark validation where up to 80% of the cases were belonging to the serotype 2, and it is a proof of reliability in real outbreak conditions. Next slide, please. Next slide, please. Yeah, so this paper could conclude that in endemic areas, the dengue duo, which is antigen NS1, including the both antibodies IgM and IgG, is the superior point of care strategy, which could balance accuracy, speed, and reliability. Next slide, please. Next slide, please. Yes, so from the same study, this picture denotes the duo, which is antigen plus antibody detection. When compared NS1 with the PCR and antibody detection with the ELISA, the POC-T test, up to 90% or more than 90% comparability in terms of sensitivity and specificity was documented. Next slide, please. So which could mainly enable triage in overwhelmed clinics. So this picture again shows that the rapid tests does have quite limited assay time within 30 minutes mainly, and did have a comparable sensitivity and specificity with the ELISA. Next slide, please. Next slide. Yeah, this paper in 2024 from pathogens could again imply that the POC-T test like NS1 antigen, that is Fujifilm dengue test, could be helpful in early diagnosis, allowing timely intervention during the critical viremic phase, could be useful in resource limited settings. In this manuscript, they have highlighted that it was particularly useful in the primary infections and it could reinforce that modern point-of-care tests can overcome historical skepticism when rigorously validated. Next slide, please. Next slide. Again, move to the next slide, please. Next slide. Yes, regarding the different assays for the point-of-care tests, the technology and applications has been evolving over the time, and modern point-of-care dengue tests are evolving beyond rapid screens. They are not just the rapid screens to integrated diagnostic systems that support clinical decisions, outbreak tracking, and equitable care. So especially when paired with telemedicine and artificial intelligence, it could make a big difference in the real world scenario. Next slide, please. Next slide. Yeah, so in short, it's been discussed by the previous speakers. That's the reason why I'm not highlighting the different technology. Yes, still you can move further. Next slide. Next slide, please. Yes. So along with the POCT test, which mainly speaks about NS1 and the antibodies IgG and IgM, they could be predictive biomarkers for Dengue. So multi-omic sensors, which includes host biomarkers like interleukins and other biomarkers, which could be non-specific, but still could make a big difference along with the NS1 for severity predictions, and AI-enhanced platforms, which is integrated smartphone algorithms for result interpretation, and microfluidics lead in performance, whereas the lateral flow assays like immunochromatography test remain the frontline workhorse for equitable access. Next slide, please. Next slide, please. Yes. So it's all about adapting either nucleic acid amplification tests or ELISA into the rapid diagnostics test. So recently there was a publication in 25, which is adapting ELISA into a tab or a microphone with the, with smartphone with the application, which did have slightly less sensitivity, but then with the improving technology, with research incorporating nanotechnology, it could become a much better technique in the future. Next slide, please. Yeah, next slide, please. Yeah, this paper is trying to relate between ELISA and the PCR, which has been done by the previous speakers, and ELISA is quite accurate when it's compared with the RT-PCR of late. Next slide, please. Next slide. Yeah, next, please. Yeah, so we have seen that PanBio and JMitra have been the main providers of the kits for NS1 and antibody detection. And we have also seen that India has developed from importer of the kits to exporter of the kit, which has made a huge difference worldwide. Next slide, please. Yeah, this picture was shown by the previous speakers, where we compare between primary and secondary infections. I'll just talk in brief about it. Like in case of secondary infection, you can clearly see that the IgG surge is at day 0. So that could be a big difference when we try to detect secondary infections. And in case of primary infection, we can see that IgM dominance without IgG being there after day 5. So use of combo test NS1 along with both the IgG and IgM could help in accurate classification. Next slide, please. Next slide, please. Yes, so it's more about re-emphasizing what we dealt in the previous slide. NS1 for sure is highly specific, and we also know that recently it has not much of significant cross-reactivity with the flaviviruses, though it may have to a certain extent, and it is highly specific up to 98%, so enables early confirmation of dengue. Mainly in case of flood affected areas in monsoons, it could make a big difference. Next slide, please. Next slide. So IgM is useful for confirming dengue in later stages and for surveillance during outbreaks. In serology, we are aware that it's preferable to use paired acute and convalescent samples where you could demonstrate the fourfold rise in the antibody titer, and which could be useful in confirming confirming the scenarios and ruling out the situations. Yes, next slide, please. Next slide. Yeah, so IgG, as stated in the earlier graph, it can mainly point out secondary infections, and that's where we have to be cautious, preventing complications and bringing down the morbidity and mortalities. And the POC-T tests are there, worldwide, trying to detect and improving the chemistry there. And advantage is mainly to support epidemiological studies and vaccination screening. Next slide, please. Next slide. Yes. So we have quite promising improvement in technology in nucleic acid amplification tests. So in POC-T, the NATs needs to be adapted to bring down the need of equipments, or making it portable. And these require minimal equipment and can process serum, plasma, or even urine. And these provide serotype specific diagnosis essential for tracking viral evolution during outbreaks, though it may not make a huge difference in treatment. Next slide, please. Next slide. Yes. So there has been a lot of multiplexing where we can detect, flaviviruses, which happen to be overlapping symptoms during the monsoon seasons, and we do have wonderful chemistries for assays like microfluidic devices and lamp-based, which have been increasing the sensitivity and specificity. So these enhance diagnostic accuracy in regions with multiple arboviruses and reducing misdiagnosis. Next slide, please. Next slide, please. Yeah, keep tapping. Yes, all right. Okay, so POC-T, in short, if you have to use a mnemonic, you could say it has to be assured, affordable, sensitive, specific, user-friendly, rapid and robust, equipment-free and deliverable. So that's what we covered in the previous slides. And the latest kind of definition for POC-T is evolved from assured to reassured, where we add two more terms, which is real-time connectivity. So it has to be like real-time when we can release the report as soon as the test is done, and it has to be environmental friendly to minimize the environmental biohazard. Next slide, please. Next slide. Yes, so to summarize the attributes of POC-T, so that it is useful in home, in community settings, or you could say in even in ambulance or flood affected areas. So the attributes includes it has to be highly sensitive and specific, where according to CDC the sensitivity should be more than 75% and specificity more than 98%. So it is highly accurate for correct diagnosis, especially in non-laboratory settings. Next slide, please. Next slide. So the ease of use. So it should be operable even by non-laboratory personnel or even self-use. So that's what we are looking at in the future about the POC-T test. So it simplifies deployment in resource-limited settings. Next, okay, stability at ambient conditions is mainly about doing away with the cold chain requirement, cold chain storage, making it having a longer span in terms of stability. Next slide, please. Next slide. Okay, rapid turnaround time. Yeah, so this is a rapid diagnostic test, which is speaking for the POC-T test. And preferably the test should be done within 30 minutes, at times maybe at 90 minutes, but most of them are able to render the report within 30 minutes. And these are critical for managing severe dengue, and naturally it can save lives in short. Portability and minimal equipment. Naturally, it has to be compact, and without plugging in, it should be functionable, like it should be battery operated, so that it can do the task at the point of care, not just the bedside. Earlier, we used to use the word called bedside test. It is not just bedside, it should be operable anywhere, including the flood affected areas. Next slide, please. Next slide. Yeah, regarding safety and biosafety, naturally, urine sample is not the one which is recommended. It has to be blood sample. So you need to go for finger pricks. Naturally, people should be advised not to have finger pricks where it can lead to infections, needle stick injuries, or to minimize the laboratory waste. In this case, it's about self-generated waste or point of care waste. And regarding data integration, it has to be real time, where the report can be rendered immediately to the clinicians or the healthcare personnel. Affordability should be affordable enough, including the cost of training and logistics. Next slide, please. Next slide, please. Yes, so other routine investigations like CBC, liver functions, and kidney functions definitely do help or complement the POC-T test in severity of the infection detection, or even to do away with the severity of the infections. Next slide, please. Next slide. Yeah, next slide. Next slide. Is this stuck?
Hello, are they sleeping or?
Yeah, so next slide is mainly about, okay, before how POC-T outperforms ELISA, there is, okay, all right. The slide is becoming blurred. It's all right. Okay. So why relying on ELISA for lab diagnosis is counterproductive? So these are the drawbacks of ELISA, mainly in terms of it being time consuming, and it requires a complete laboratory setup. Yeah. So naturally, the POC-T test outperforms ELISA in many aspects, it being user friendly and requiring minimal equipments, and it can be done at any setup, including home or ambulance, or during monsoons there could be flood affected areas. So that definitely POC-T test outperforms ELISA in many aspects. And with the latest technology, we could say that POC-Ts have been advancing, and it could make a big difference in the future. So in short, you can say that we can prevent complications of dengue and save lives using POC-T. Yeah, I end here. Thank you. Thank you,
Very
Prof.
much, Dr. Godfred. And of course, you might be happy to know that recently there has been a tendency to move towards home testing, and NS1 home testing, which is positive on day one of fever is available, and it can be done up till 7 days. So
Yeah.
in the first 7 days, you can do NS1 so that you are, as Dr. Saurav mentioned, this is a paradox in when you have when you say about dengue fever, when the fever subsides, you enter the critical phase. So during the fever, you want to know, is it dengue? So that you are ready to be there near the hospital. If you have suffered from hemorrhagic symptoms or you have had shock, then survival becomes difficult. That is why you need to know beforehand whether you are suffering from dengue or not. And as I think it's been brought out, that secondary dengue is more dangerous than primary dengue.